All right, so I'm going to go ahead and get started with what I prepared for you all today. And in my announcement and on the screen, I said that we would cover year-end reports and requirements for home care agencies. Most of the things I'm going to cover today are things that are in your policies and procedures. What I did was went through there. I did this, a subset of this back in, I believe in March at the end of the quarter, so that everyone could start looking at what kinds of things you need to be doing on a quarterly basis. So this is pretty much a compilation of all of those things that you need to be looking out for. You're doing it each month, and hopefully at the end of the year, you can just pull that information together. And one thing that it did for me is when I knew at the end of the year I was going to have to look at certain things, I started to organize that information differently as the months went on so that it was handy and available to me when the time came. So first, I want to start to go over some of the annual things that you need to be doing at your agency. At the end of every year, and most of you are doing January to December, there needs to be a comprehensive agency operation report. You should have some type of a template that you're using. That's part of your policies and procedures, where you go in and check certain things. I'm going to go over a couple of those just to highlight what kinds of things in there. But that's basically, it's pretty comprehensive. It goes over the financials. It goes over a lot of things. But should you ever get a survey/audit, usually when they come in, they want to look at these reports to be sure that you're doing them, and then it will target certain areas. If they just randomly came in and they're not working a complaint, they can look at these reports and see how the agency is operating. The other thing that you want to do on an annual basis is you want to review your discharges and the reasons for discharge. Because if you're constantly getting people discharged because their aide is not showing up or they're leaving early or not doing their work, that's an area that you really want to address. Excuse me. And that's something that the surveyors will look at. So pay attention to your reasons for discharge. And if they're repetitive, you want to put that as an area that you want to start working on. Also, everyone should have a client complaint log. We hope that log is empty, but sometimes you have to put something on that complaint log. So if you have complaints, you want to also look at those, be sure that the same complaints are not coming in over and over again. Sometimes you find that complaints are coming in from the same client, and so that gives you some information. There may be complaints coming in on a certain employee. So sometimes you're doing everything just fine, but it's just sometimes people don't work well together. In the time of COVID, you need to be reviewing your exposure control plan. And that would be if your employees are exposed to any type of infection, COVID, whatever, there should be an exposure control plan in your policies and procedures that you review and make sure that you have a plan to handle those as they come up. As I mentioned, all of this should be in your policies and procedures. And what I find is that we all get so busy, because it happened to me when I was running an agency. I would get so busy that I wasn't really making sure that I got these things done. And it's kind of terrifying when you look back in your policies and procedures and you're like, oh my God, I really need to be doing this. So just keeping this going on an annual basis or a monthly basis, you can stay caught up, but then you need to bring it all together so that it's in one place. For those of you that do Medicaid, there's a Medicaid attestation form that you need to fill out each year. It's a one-page form. I don't know, you should be familiar with it, but it says something like, we did our customer satisfaction survey. There's several things on there that you need to attest to, and it usually has to be sent in by the 31st of December every year. So look for that to be sure that you're doing that, because it's part of your responsibility for Medicaid. Not only should Medicaid agencies be doing customer satisfaction surveys, but everyone should be doing those. You want to know what types of things you may not be doing well in your agency. So I had a one-page customer sat survey. It had maybe about 10 questions on it and a place for them to write in things. Now, the way that works is you're supposed to send your customer satisfaction survey to all of your clients. But if they don't return it, of course, you just count the ones that get returned. But it should go out to everyone. And then you look at what type of trends you have going on there as well. Going back to this same agency administrative review, these are some of the things that are on that review. Everyone should have an organization chart. When you did your policies and procedures, right in the front, you had an organizational chart. And it usually works something like this. The agency director is at the top, or maybe the owner is at the top. Then the agency director, then your RN supervisor, and if you have a service supervisor, they would be kind of hand in hand. Below the RN would be your in-home aides, and below the service supervisor would be your companion sitters. Now, you don't have to have a service supervisor. Your RN supervisor can supervise all of those individuals, but you need to know and have that organization chart available, because if they come in and start looking at, who reports to whom and who gives them this information, they're going to ask you those questions according to who they know is responsible for you or is your manager. So just make sure you have that visible. And then the agency should be meeting all current legal requirements. Now, one of the things that the state of North Carolina tells you is that you're supposed to be in compliance with all state and federal laws. So if you're supposed to be paying your taxes or anything that you need to do, or updating a license, whatever you need to do, it needs to be current and in place. So just know that it's not just your DHSR information or rules and regulations. You need to be compliant and current with all rules and regulations, state and federal. Each year you need to check to be sure all your professional personnel hold a current license. That would be your RNs for sure. And if you have LPNs in your agency, depending if you're doing nursing services or whatever, you just need to be sure their licenses are current. And then every program, probably in your scope of services, in your policies and procedures, you stated what your outcomes are, what your goals are for the agency. You want to be sure you're meeting those goals. And if you're not, you want to go ahead and fix it. Or if you don't have any goals that the agency is working toward, you want to get some in place. I also thought that the agency administrative review for personnel was one I wanted to show you today. You need to have an administrator and an alternate. Now, the way I've been noticing that lately is when I've been doing policies and procedures lately, what they've been doing is if there's something in there that says the agency director will notify DHSR if our license, is going to be revoked or we have a complaint or whatever. So they want you to put, if the agency director is not available, then the service supervisor will do it. And that's going back to your organization chart. There needs to be an alternate. So if that person is not available and they're not in place, the next person in line needs to do it. So you can't say, oh, we don't have an agency director right now, so it didn't get done. It needs to fall to the next individual. And they have us writing that into policies and procedures now. We all know that at all times that you have people working in the home, that you're supposed to have someone on call. So it needs to be a supervisor or an alternate that's available. If you're just a companion sitter agency, it probably can be It wouldn't need to be an RN, of course, but it needs to be someone. You can have an answering service to answer your phone, but there needs to be someone that answering service can call and get to them at all times that someone is working in the home. And then it's not a bad idea to have someone to refer calls to or situations to, even when people are not working, because there's times when some of your clients something's gonna happen overnight, or they're gonna go in the hospital. Their families may be nice enough to call at night or first thing in the morning and let you know not to send your aide, or let you know what's going on. So if you have an on-call person, you'll have that information, and it could save a wasted trip. Everyone needs to have, of course, your agency needs to have those written personnel policies and procedures, and everyone should have that section in their policies and procedures. And you need to be sure that you're following that. Of course, everyone needs a background check. Everyone needs to be checked on the nurse aid registry. You need to call and check on their previous employment. Those are things that you've committed to in your policies and procedures, because when they were approved by DHSR, they made sure that was there. So make sure that's going on, with everyone. And it is very simple, but everyone should have a personnel file. The agency director, all of those people, everyone that's employed that does anything should have a personnel file. Now, sometimes when an agency is getting started, the agency director will say to me, because there's a lot of places on the application that the agency director needs to validate or sign. So in the beginning, as the agency director, you're basically hiring yourself. You're the witness, you're all of that, because that's the first person that gets hired, and then it goes down from there. It is a little strange and awkward to have to sign that in the beginning, but that's the only time. So the agency director has to have all of those things in place, the background check, all of that. So just keep that in mind. There's a number of updates that employees will need on an annual basis. We know that once you hire someone, there's certain mandatory in-service training that you do. OSHA, safety, bloodborne pathogens, TB, pandemic or COVID-19, and electronic visit verification training. Those that are doing Medicaid, they're doing EVV as well now. Most of the private care agencies do it also. And that is where your aide goes into the home and they electronically transmit their task over the telephone or however they do it, or on an app. So you need to make sure they're trained on an annual basis. And so that you may say, Janie, do you need to be retrained? And she's doing a good job. You don't have to do that, but you maybe need to make a note that they stated they are trained on electronic visit, because you don't want that to be an excuse as to why they're not doing it properly. Also, your emergency preparedness, that is huge. That's a big part of your policies and procedures. And what I do in my training is I extract a portion of that and put it into the training manual, so that they get to review that every year and they know what's expected of them for emergency preparedness. It has things in there like what happens if someone faints, when do you call 911? How do you handle if you're going to be out? Weather preparedness, all of that is in there. So that's something you want to do on an annual basis. Everyone that works for your agency should have a yearly performance evaluation. And the best way to do that is everyone has a hire date. So if they get hired in December, do their evaluation in December. It's a little bit tough to try to do everyone at once, because first of all, it'd be a big workload, and then it may not be a full year, just be too much. So have a way to know when everyone is due and make sure they get a performance evaluation. They're supposed to review it, sign it. That is also a very good time for them to do their OSHA and safety and bloodborne pathogens training. One thing I just thought about on the mandatory training. Some of your aides work in other places, like they may work in the hospital or at another agency or something like that, and they may do OSHA and safety and bloodborne pathogens and all of that. But you must do bloodborne pathogens training at your agency. You cannot assume that, even if they show you that, that's one you have to do. You can accept the OSHA and all that other stuff, but you have to do bloodborne pathogens. So it's best to just do the whole thing so you're sure that you're covered. Each year when you do the performance evaluation, go ahead and check the healthcare personnel registry. I did notice in the last few months as we've been doing policies that some of the approvers have been asking for a healthcare personnel registry check, even on the RNs. And I had not seen that in the past. But you do have some RNs that were nurse aides before. I think, I'm almost sure now, before they even go to nursing school, they have to be a CNA or nurse aide before they get in school. Back when I went to nursing school, it wasn't a requirement. It would have been very helpful, but I didn't have to be a nurse aide. So just keep in mind, check the healthcare personnel registry on everyone, not only those that are on the registry that you know should be on there, but even your companion sitters, check it for everybody. And I got a call the other day from someone that said, well, there's nothing on there about them. I said, but you did check it. It gave you a report. Print the report and keep it, because that shows that you're following all of your procedures to make sure that you checked it for everyone. As far as your clients need a reassessment by an RN on an annual basis. This is one that's kind of easy to miss. Your nurses are going out there doing supervisory visits. At any given time, they can do a reassessment. You know, they're doing somewhat of a reassessment when they go, but they need to, whatever your reassessment form is, the physical assessment and all that, they need to at least have one of those once a year. And a good time to do it is on their anniversary date. That's the date you admitted them last year. So that was one that was kind of hard to keep up with, but just make sure that you're getting that done. Those of you that do Medicaid, your service plans need to be updated once a year or when there's a change. Now, pretty much Liberty is going to come at you for that. They're going to let you know this is a new service plan or whatever, and then you update it. And then I talked before about the customer satisfaction survey, which is also required for those Medicaid clients. And that's basically what I have covered for you all today, as far as things that I know you need to be looking at on an annual basis. And I know that you all receive your annual renewal from DHSR. You should have those now. So we know you need to do that. So I didn't feel like I really needed to mention that one to you. So just make sure that you all get that done. And then all of these other things that I just mentioned to you, just have them on your list of things to do. So do any of you have any questions about what I have covered, or a question about something else that you would like to discuss today? No questions?
Hi, I had a quick question.
Okay.
And for the annuals, I always have a issue with this, and I want to get some clarifications. We don't have to do an annual update for employees for incident and accident. That is just upon hire.
An annual update for incidents and accidents.
Incident and accident reporting, the training.
Well, is that related to your insurance company, or are you talking about OSHA?
No, I don't think it's OSHA. It's the incident, how they would, if a fall occurs in the home and we have to report it, how they would report it to us. I know from audit that had happened where they had came in and done our records, They
Mhm.
had got us for missing some incident and accident trainings. And it's just a confusion for me that, and since then, I've just been doing them annually. But
Mhm.
I just wanted some clarification to see if that is an annual requirement or it's just upon hire.
Okay, so if they came in and said you needed to do accident and incident training, that was probably something I would put into the annual training with OSHA and safety, because there was safety in there.
Okay, yeah.
Safety is one of the things you need to train on, and that's when
Yeah.
you would talk about accidents and falls and how you lift someone and all of that. So
Okay.
just incorporate it in there and put the correct name on it. If they don't want to call it safety, if they want to call it accident training or incident training, do it that way.
Okay.
However, whenever there's an incident that happens in your agency or in the home, when your aide is there, you do want to fill out an incident report.
Right. Okay.
Yeah, there, I had a one-page form that had all of the information on there, and I had things on there like, did you notify the family? Because sometimes they're not home. Did you call the doctor? You know, what was the outcome? So that is a running report. That's something that you would review probably at the end of the year. But whenever it happens, make sure you complete that report and you
Okay.
fully fill out, because one of the things that we learned in nursing school is that you put that information on an incident report. You can make note of it in the client's nurse's notes, but the real detail is on the incident report, which is kept separate from the client's file. You have an incident report file. So that's a good way legally to do that.
Okay.
Does that help, Shanice?
Yes, it does.
Okay.
Thank
Does
you.
anyone else have any information about that? Accidents, incidents? Anybody else want to share anything? Okay. So there's not a whole lot I know I mentioned this last month when I went to the Home Care Association annual conference. They are looking closely at infection control. So you all have a big section in your policies and procedures about how you control infections. And of course, that is, how do you distribute your PPE? Um, how do you get it to the aides? What do you expect of them? Just making sure that infection control is taken care of. Are they wearing masks? Are you giving them a shield? What is that? But I don't recall in the past that was being looked at as closely, but we can see why. So infection control is very important now. And I know that PPE is expensive, but there has been a little bit of assistance from the Home Care Association and some others in the community that have been helping out, but just make sure your aides have what they need. When I was doing it, we basically just had to supply gloves, and I had gowns as well in case a client had something that was contagious. And of course, a lot of our aides go from one client to the other. So I wanted to make sure they had a covering, if they needed it. But now it goes a lot further than that. But at the very basic, you should have the gloves and the mask.
Hello.
Yes, go ahead.
Hi, this is Chanel. I'm fairly new. I went on the the Home Care Association website looking for how much it costs to join. I may have overlooked it, but does anybody is it based off of certain criteria as for how much you pay, or is it one set fee?
It is based on your annual revenue.
Okay.
They have several. One thing that they used to do, and I hope they still do it, is that your fee can be large. I mean, it can be more than $1,000, $2,000. They have offered payment plans in the past where you pay by the quarter. So that can make it a lot easier for a smaller agency where you don't have to pay it all at once. I hope they're still doing that. You may have to ask them, but they've had it where you can give them your credit card and then every 3 months they'll charge a certain amount and it makes it a lot lighter. I believe they're still doing it and I will check in with them. And if it's not that way, I will let you all know, but they're pretty good about giving you not a discount, but allowing you to pay in increments because it can be significant, especially if you're bringing in a lot of revenue, which is good, but it does go by your annual revenue and you renew. They're also getting ready to have their annual conference in April. It's going to be at the Marriott, the end of March, 1st of April. It's going to be at the Marriott at Crabtree. And I usually try to attend that every year because they provide a lot of good information. The one for leaders that they had in Wilmington last month was very good. I learned a lot. All right. Anything else? Any other questions? It doesn't matter what it is. It doesn't have to relate to what we talked about today. Any other question?
Miss Patty?
Yes.
Or any other agency owners, have anyone heard anything about the hazardous pay for workers? I've seen it on in Virginia and different states where they gave, extra incentives or extra money, bonuses, and then they retroactive to back in March. Do anyone know anything about this coming to North Carolina?
You mean the state sponsored it, Natisha?
Yes, it was like a grant or a loan or something that you can apply for. A grant, I believe, that they gave to workers because, they're overlooked in a home care setting. Virginia did it for during this COVID time. And I had a caregiver that asked us a question about hazardous pay. And that's kind of what sparked the conversation with all of us about it.
Mm-hmm. Shanice, you usually stay on top of things like that. Have you heard anything?
I have not heard anything about any hazard pay. I know that they increased the rates recently for Medicaid providers, but that is about it. And they was suggesting in using the increase to help with like things like hazard pay or bonuses or things like that. But as far as an individual hazard pay, no, I haven't heard.
I saw was $19.84 per hour. And of course you bill in 15-minute increments. So that would be divided by 4. John, do you have any information on that?
Well, I think we are not doing Medicaid right now for CNS, but I've looked at the Medicaid website, and I think for skilled care is around $11 and something per 15 minutes.
But that's skilled care is what you
For
said,
skilled
right?
care, yes, but I don't have anything about CNS.
Yeah.
I think about the hazard pay that she talked about earlier, there is something coming out of the bill, the bill that was signed by the president, the bill something bill that's coming. They are talking about giving money to home care agencies to take care of their caregivers. So I think there's something coming out of that.
Yeah, that's what I was hearing too. Something with Biden signed some order coming out of that. Yeah.
Yeah, and it's big,
That Build Back Better bill.
We were thinking of training PCAs in our agency. Is that something we can do and use them as certified trained PCAs in our agency?
You cannot certify them, John, because there are certain agencies that have the authority to train and get them on the registry. And as a regular agency, you cannot do that. Now, if you go through all that you need to go through and you become an agency that can teach and get them on the registry, you can. However, you can train your PCAs to be in-home aides, which means they can touch the client. If they're just companions right now and they can't touch the client, you can, as your RN, can train them, teach them how to give a bath and all of that, and then they can become an in-home aide. But still, there is the restriction that once that client's level of care gets to extensive, where there's like 2 or more ADLs that are extensive, that they need more than 50%, help more than 50% of the time, then they would not be able to work with that client.
Sure, sure.
Oh, but there's agencies around and people that do that training. And as an agency, just a regular agency, you cannot take
Right.
someone and get them on the registry. Yes.
Okay.
So are there specific modules to use for that training or no? For the, for the PCS?
To make them an in-home aide,
Yeah.
I think the best thing to do would be to get the nurse aide training book,
Yes.
the book that they teach from. And then in that case, what you can do is you can train them client specific. Like if they're working with a client that needs certain things,
Yeah.
then you go ahead and concentrate on those areas.
Right.
Because every time you move them from client to client, you need to be sure they know what they're doing. But if they're on the registry, you don't worry about it as much. But when they're not on the registry, you need to train them to be sure they can perform those tasks with that client. But every agency should have the nurse aide training book, some type of book that has all the tasks in it, how you give a bath, all that you do, and you can pull information from that to do your teaching.
Okay.
What is your advice on electronic medical record software? Which ones do you know are in the market and that are probably popularly used by a lot of other agencies?
I don't know what everyone is using, but there's several that are out there.
Okay.
And most of them, if you get electronic visit and all of that, they come with, electronic records.
Right.
Does anyone on the call have one that they highly recommend? If you looked at several and you've gotten one that's working well, anyone would like to contribute to that?
Yes. Sembra Care. I work with Sembra Care. I highly recommend them. They do the electronic records, and basically too, they help to keep you in compliances. They also have the electronic visit verification. Yes. So they're always available for help. I highly recommend them.
We're using ClearCare.
Yes.
And that's another kind of premier industry, long-time company. The nice thing about it is it has a couple of integrations, like for collections to credit card processing. It does have EVV, and just has a rich history. A number of franchise brands use it. So it's probably more expensive than some others, but it works really well.
Right. Thank you for that, Frank. They are one of the big ones, ClearCare. And Frank is a private agency. He doesn't do Medicaid. So I'm sure that it is important that they're able to bill and do collections and all of that. And many of you have a lot of private clients too, and you want to be able to manage that. Now, some of you that are new to home care and you've only been doing it for 7 or 8 months, you can do all of that stuff and just keep going on a manual basis until you really build up and you can afford to do these things. And if you do that, once you go out and choose some software, you know exactly what you need. When they're trying to sell you things you don't need, you're like, no, we can handle that. We need this, 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 and this. So get familiar with what you're actually doing and then just progress from there. But there's several out there that I hear about all the time. So that's good that you mentioned those. Tarshia, did you have something?
No, I don't have anything. That was my question about the EHR. That was answered. Thank you.
Okay, thank you. Thank you for coming. Any questions about anything else today?
Hi, Ms. Williams. I am actually, excuse me, in the process of everything, and I wanted to know a little bit more about the EVV software. Is there several out there? I just wanted to know a little bit more about that.
Okay, so for those doing Medicaid in North Carolina, Medicaid chose a system called SAN Data. SANDATA. That is a system that the state of North Carolina chose, and if their Medicaid providers use them, there is no fee for the basic function of EVV. So that's certainly one that you want to look at, because when North Carolina went through that process to choose SANDATA, they looked at all of these systems. Everybody competed, and SANDATA was chosen. So just keep that in mind. That may be one, if you're doing Medicaid, I'm not sure, but they'll do it even if it's private. So look into them. And then also the others that they mentioned, all of them have EVV included. Nowadays, they have to. But we know that SANDATA's information feeds directly into the state system.
Patty, what was the name of the training booklet? And do you just Google it, or you order it from DHSR, or is it downloadable?
The nurse aid training booklet?
Yes, ma'am.
You can probably go onto Amazon and find one. I'm
okay.
Talking about a nurse aid textbook.
Okay. Okay,
now,
so it's not like a specific one that the state recommends, like
there probably is one that they use, but I don't know. I do have one that they used to use, but I'm not sure if they've changed. So one way that you can find out, Frank, is to get in touch with one of the agencies that does the training. I know Care One Nursing does it.
Okay.
And I just ran into another lady this week, a company called Shades of Purple. Have any of you heard of that?
I was going to ask you about it because I just saw their name the other day.
Yes, I just met her at a meeting this week, and she's been in business for 12 years, and I was out there and I never met her. But she has an agency on Six Forks Road. She teaches CPR, phlebotomy, CNA, all of that. So people like that can let you know what the state textbook is. And I would get the state textbook. But if you're just going to be doing, training, there's several out there, because I was Googling that this week looking for some other information, and I saw some really good ones. Because you're just going to select certain things that you're going to teach. But before they got it where you had to go to one of those agencies, they used to have it where you could teach your aides at your agency and they could test out. They could pay $100 and test out. And I was able to get 4 of my aides on the registry that way. I had the textbook that they used to use. They would go through the book, answer all the questions. I would have them come into the office, teach them blood pressures and all of that stuff. And they went and tested out, and they're on the registry today. But 6 or 7 years ago, they stopped that. Everybody has to go to school now before they can take the test.
Gotcha. So there's what do you know if there's any reciprocity, like from folks moving in from out of state, or what you're saying is that they actually have to go through a course before they can
Well,
sign
I thought, Frank, that during COVID, I did see that they were accepting those, but I'm not sure where that information is. You probably need to go to the ncnar.org. That's the nurse aid registry place that you go to verify whether someone's on the registry, ncnar.org. I believe I saw something during COVID where they said if they came in from another state, that they may have a way for them to transition over to our nurse aid registry. But
Okay.
it didn't used to be. It used to be they had to redo it. And, with nurse aid work, it's pretty much the same, but I'm just not sure of that. I'll make myself a note to see if I can find something, and I'll let you all know. Okay, well, it was good seeing you all. I hope you all have a wonderful holiday season. Everyone on this call knows how to get in touch with me. You probably got an email from me, or you have my phone number or my cell phone number. If you need anything from me, just feel free to contact me and I will get back to you. But in the meantime, have a wonderful holiday. And we are still going to continue to do this on the second Friday of every month. you're on our email list, we will make sure that you get that. The second Friday at 1 p.m. is when we'll do it. Also, we're looking at starting a podcast in 2022. And if we start a podcast, we will ask probably most of you to come and talk about your business. Anything that you would like to share, we'd like to make sure that we showcase you all and let people find out about your business. So we'll be in touch surrounding that, but that's something else we're working on for 2022. All right, thanks to all of you, and you all have a happy holiday, and I hope we see you all back here safe next year.
Thank you. Thank you
Thank
so
you.
much.
Same to you, Miss Patty.
Thank you.
Thank
Thank
you.
you. Bye-bye.
Thanks,
Bye.
Patty. Thanks. Bye. Merry Christmas.